A 17 years old male patient presented to our OPD with a gradually progressive, painless solid mass over superolateral margin of his left orbit. He gave a similar history of swelling at the same particular area for which he underwent a surgical excision 1 year back. Due to his previous history and an atypical consistency of the mass, he was already refused by many institutions for any surgical intervention as they were not able to come up with a proper diagnosis. After a proper ocular examination and various radiological examinations and excluding any intracranial or intraocular connections of the mass, we decided not to disappoint the patient and took into our hands for a surgical excision. It was a tough decision from our end as we had to proceed without any proper instruments such as bone saw or bone drills or suction machines to deal with any complications intraoperatively. As we started approaching the mass by giving a skin incision and dissecting out the subcutaneous tissue layer, muscular layer, and the orbital septum, the first hurdle was to cut the periosteal layer, which we did using a 11 number blade on a BP handle. The deeper we approached, the situation was getting tougher, as now we realized that this mass was extending from the superior orbital rim. So now we know that we are dealing with the osteochondroid mass. However, with the use of the limited resources we had, that is, with the use of periosteal elevator and a monopolar cautery, we kept dissecting as far as possible, keeping utmost care not to damage the surrounding orbital fat pad and keeping the surrounding anatomy intact. After struggling with the limited resources we had in our hands, we could be able to dissect out the osteochondroid mass. The histopathological examination done later confirmed it to be a chondromyxoid hamartoma.
छोटा छोटा क्लिप्स ठीक है लंबा भी ले तो कोई.
This particular case taught us that however tough be the situation, determination and dedication towards the patient care by our medical professionals can always get the tough going. Thank you.